of the autoimmune conditions also have some gut-specific pathology or some viral etiopathogenesis, which ultimately leads to a sequence of events and the autoimmune diseases. So the terminology of NASH is now changed to MASH. The gut should be considered as the actual soldier.
Hello and warm welcome to MedSynapse podcast, where we bring you insightful conversation with leading experts in medical field. Hi, I'm your host, Dr. Smarika Bhatt, and today we are joined by Dr. Meghanath Yenni to discuss a fascinating and something overlooked topic, the role of gut health in chronic illness. Dr. Meghanath, a distinguished consultant physician with over a decade of experience in general internal medicine at Medicover Hospital and First Choice Clinic. With postgraduate diploma from UNSW in infectious disease and Johns Hopkins University in rheumatology, he brings a wealth and vast experience on our discussion. So, Dr. Meghanath, before starting our podcast, can you give me a brief about what interested you in gut health?
Yes. Thank you, Smarika. Thank you for the kind words of introduction, and thank you for your time and for your patient reading out my profile and bio. Yes. So I think the world is changing now. We are moving in a direction from treating or curing diseases to preventing. So we are more focusing on promoting health rather than promoting cure and treatment. So, and there have been many research which are going across in the world to improve or to prevent health. You might have heard something called the primary prevention of many health diseases. And one such fascinating and interesting aspect which has gained a bigger mileage in the last few years is about the role of the gut health, and how it impacts the overall health of the human being. We have been practicing this for years, about a lot of our probiotics and all these stuffs. But let us delve more into deeper insights and the scientific aspects of this entire thing.
Okay, thank you so much for the kind introduction and the description of your previous progression. So we'll start with the fundamental question that many healthcare professionals and patients are grappling with, that how does the gut health microbiome influences the development of progression of chronic diseases? We are particularly interested in the condition like diabetes or cardiovascular disease or autoimmune disease per se.
Yes, Marika. So to set the ball rolling, let me give you a fair description about how the human body works. To put it in simpler terms, like human body is always at war. That means human body is fighting with so many internal and external forces. Okay. And if you take this as a warlike situation, then brain is the commanding center. So that is where all the commands pass. And the heart can be considered as the commander, which follows the commands from the commanding center. And the gut should be considered as the actual soldier. Okay, that is why, because the gut actually does the war on metabolism, flushing out all the unwanted or toxic materials, maintaining the integrity of the body's epithelium, helping in immunity. So the gut plays the major role, and gut is actually the foot soldier for the entire body. And we know the role of gut, the gut microbes for long, how the gut helps in promoting local immunity by secreting very specific immunoglobulins called IgA. You might be heard of it. So which promotes the local immunity, maintains the interstitial epithelium, and all these things. But of late, we have been observing that these functions aren't just limited to the gut. There are distinct mechanisms where gut acts too. Okay, so these effects can be seen in the brain, these effects can be seen in the heart, the lungs, and even on the mental health of a patient. So the fascinating thing is, we humans are already colonizers of a large, almost lakhs of microbacteria or microorganisms on our body. Okay, so we have them all throughout the body. But the specific part about these microorganisms is they are niche specific. That means the organisms which are there on the skin differ from the ones which are there in the oral cavity, from the ones which are there in the gut, to the ones which metabolize in the liver, to the ones that are in the genitourinary tract. So these organisms have specific set of function, there's specific set of composition in different parts of the body, and how they help in maintaining health and maintaining the barriers all throughout the things. Now, for long, the role of these microbes is nothing new. We all know about, you might have heard about fermented pickles. So for long, we have been using fermented pickles. Fermentation is, of course, the extra salt, and this has some side effects. But the entire process of basic fermentation itself is very health, and it has many beneficial aspects. Now, let me tell you a simple example. Probiotics, where we use very commonly, and the best case study is we use them in conditions called inflammatory bowel diseases, like ulcerative colitis. They have a very important role. Now, if you see, the ulcerative colitis is an autoimmune condition. Okay, so of late it is observed that most of the autoimmune conditions also have some gut specific pathology or some viral etiopathogenesis, which ultimately leads to a sequence of events and the autoimmune diseases. One more best example, let me tell you, where the gut microbiota help another autoimmune diseases is you might be knowing patients with eczema, atopic dermatitis. So you might be seeing that patients who go to doctors with chronic allergies, they'll be prescribed on probiotics. They might be prescribed on some anti-helminthic drugs. Okay, so these parasites, the worm infestations, all this cause eczema and dermatitis. There is type 1 diabetes, another autoimmune disease, and it is found that in type 1 diabetes, there is entire alteration in the gut microbiome as early as 4 months of age. So the type 1 diabetes is basically diabetes in the adolescents and the children. So it is found that there is alteration in the gut microbiota as early as 4 months of age. And if you can see the chronic diseases, like you might have heard about this omega-3 fatty acids. Okay, so these are also the omega-3 fatty acids. How they act is basically they enhance the absorption of these very important short chain fatty acids. So these short chain fatty acids also help in lowering the mean arterial blood pressure, lowering the cholesterol levels, and all these things. So these are many other aspects of how the gut microbiota may play an important role in many chronic diseases and even in autoimmune diseases.
Okay, thank you for addressing the microorganism all over the body, majority of them. So now I'm curious that when we talk about interventions like probiotics or prebiotics or synbiotics, so what does the current evidence actually tell us about their effectiveness, and how can healthcare providers responsibly integrate these into treatment plans?
So, as I have said, the concept of food as medicine, okay, is very old tradition. You might know Hippocrates said, "Let food be thy medicine, medicine be thy food." So if you don't take food as a medicine, there might come a situation where you have to take your medicine as food. So it was very beautifully illustrated by Hippocrates and highlighted the importance of diet. So diet, in simple, is it can be a vitamin, it can be a toxin too. Okay, so it can help you as a vitamin cope up with diseases, or it can be the toxin too. So as I have said, this is an age-old tradition. This is nothing new of using prebiotics and probiotics. So what is a probiotic in simple? Let me tell you. Pro is, bios means life. So pro is something which has life or something which helps in enhancing life. That is what is called as a probiotic. And most of these probiotics are living microorganisms. Now, a version of it called the prebiotic, which is not a living thing, it's an inanimate thing. But what a prebiotic does is it helps in growth and promotion of the probiotic. So that is called a prebiotic. And when you use both together, so one helps and synergistically acts with the other. So the pre and probiotic together in a capsule, we call it as a synbiotic. Now, the best example of probiotics, we all know the simplest thing, let me tell you, it is for acute watery diarrheas. So for acute watery diarrheas, we use probiotics, whether it is viral diarrhea or bacterial diarrhea. Now, most often, most clinicians and even patients think that the probiotics reduce the frequency of stool or they reduce the intensity of stools. But that's wrong. Actually, what the probiotics does is the probiotics actually eliminate the harmful virus or bacteria. So that is how it works. It actually eliminates the infection. As I said, because of the specific IgA immunoglobulin, with that, it helps in eliminating the virus or bacteria. And then there are many other probiotics too. You might have seen a lot of probiotics these days which are promoted for weight loss or specifically for PCODs or insulin resistance syndromes. You might be seeing them. So there are many probiotics which are now gaining importance in many of the chronic diseases like insulin resistance syndrome or the metabolic syndrome to be specific. Then even in for dyslipidemia and even for fatty liver, which we call the MASH LD or the steatotic liver disease. So the terminology of NASH is now changed to MASH, which is a metabolic associated, because more and more of the metabolism and the visceral adiposity is coming into picture. So these are all the examples of the probiotics. To give you a few examples of prebiotics or synbiotics, as I said, prebiotics are non-living, inanimate. In simple, they are naturally occurring. Okay, so you can say in simple, you can say prebiotic is a fiber. Okay, it's a dietary fiber. So the biggest consumption of dietary fiber is from the carbohydrates. So if you take the starch or oligosaccharides to be specific, these are all considered as prebiotics. And if you have seen some of the compositions, you might have seen on the composition, there are 4 to 5 strains of probiotics, bifidobacterium, lactobacillus, and in the end you see something called inulin or something that is the prebiotic. So this prebiotic helps in growth of favorable probiotics. So when they're combined together, it can be called as synbiotic. Now, one important aspect of these prebiotics, as I said, they're equivalent to fiber, the naturally occurring starch. There is colon cancer, if you know, is one of the very important lifestyle cancers, and it is proven that with adequate lifestyle changes, with good intake of fruits and vegetables, high quantity of fibers, the incidence of colon cancer comes down. So there is a very large study which we called as SynCan study from the Europe. So Syn is for synbiotics for cancer. The synbiotics for cancer, there is a very large study which is going on in Europe to study the role of these synbiotics in preventing cancers, especially the colorectal cancers.
All right, Dr. Meghanath, let's move on to the next question. One challenge many healthcare providers face in identifying dysbiosis in their patients. So could you walk us through the most reliable diagnosis tools available today? What does doctors be looking for in the future?
Yes. So dysbiosis is simple, like when you don't have the symbiosis. So usually what happens is, as I said, the microbiota composition is as good or as important as body will be full of those healthy microbiota. There will be the harmful microbiota too in the body because of our food and other dietary habits. But what is more important is the balance. So obviously the healthy one should be more and the harmful one should be less. So if this balance is disturbed, which we call it as dysbiosis. So this dysbiosis can be caused by various factors. It could be simple because of the genetic factors in the patient. It could be because of the dietary habits, say high sugar or high salt, or it could be because of the lifestyle changes, sedentary habits. It could be because of any personal habits like smoking and alcohol, or it could be because of something called xenobiotics. So xenobiotics are a lot of usage of overusage of antibiotics. It could be because of pesticides that enter into the food chain, or it could be because of some other toxic fumes or gases. So these are many ways how this dysbiosis occurs. So as I said, the balance between this is very important. Now, let me tell you a very important, very simple example of dysbiosis, which we quite often see. You see in postmenopausal women. So what happens in postmenopausal women? The estrogen secretion is reduced. Okay. And this estrogen secretion is very much important for maintaining the vaginal pH of women. Okay. And it needs to be acidic because that is how it protects from vaginitis and severe vaginal infections. So this pH. And there is an abundance of lactobacillus in the vaginal epithelium that usually prevents from premenopause, not postmenopausal women, from severe infections. So in postmenopausal women, what happens is, because of the lack of estrogen secretion, this lactobacillus is lost, the pH rises, and these women are prone to very severe infections, including something called urinary incontinence too. It is seen that even urinary incontinence is also a factor for dysbiosis. And one very fascinating aspect of dysbiosis, let me tell you, is you might have heard of fecal microbiota transplantation. So the FMT, which we call, which is US FDA approved with almost 98% cure rate for something called Clostridial difficile infections. It's a very serious Clostridial difficile infections. So where the entire healthy microbiota is transplanted into the diseased patient with Clostridium difficile. So this is one fascinating aspect. But now why I am highlighting it in terms of dysbiosis is because now this FMT is also researched into other domains of treatment. Say, for example, it is studied for Parkinson's and Alzheimer's disease, where there is a clear-cut gut and brain axis involved, and it also is studied for fatty liver and other serious diseases.
Okay, that was a very well put together answer. So, okay, Dr. Meghanath, can you help us, listeners who are also healthcare professionals? Could you provide 3 concrete actionable steps they can take to start in integrating gut health strategies into their...
See, ultimately, the purpose of the talk is how to extrapolate it into clinical practice and what all we can do in our clinical practice. So, few things, let me tell you, diet. Okay, so make sure your patients are ourselves. So we have to begin that probiotics should be a part of our diets, or fermented foods should be part of our diets. As I highlighted, the importance of prebiotics or taking high amount of fiber. And third important part, let me highlight today, is avoid using sugar or even sugar sweeteners. So artificial sugar sweeteners are as dangerous as using sugar too, because what happened, the interesting fact is these low-calorie sugar sweeteners are once introduced to combat obesity and metabolic syndrome. But what they have in turn done is they have caused dysbiosis and caused more of insulin resistance. So artificial sweeteners do more harm than good. So I want to highlight about artificial sweeteners. And the fourth part, let me tell you, is about the usage of antibiotics. Unnecessary usage of antibiotics kills the good bacteria, promotes very harmful and toxic bacteria. So avoid unnecessary usage of antibiotics. And of course, the simple things, the balance between sleep. Sleep, again, good quality sleep. It's not about how many hours you sleep, but good quality sleep, managing your stress, and of course, quitting on smoking and alcohol. The entire gambit will help in fighting the chronic disease menace.
So as you touch upon artificial sweetness, is the brown sugar, stevia are on the same page, or they have good benefit?
Yeah, so the brown sugar is a different thing. Stevia will be more considered as a more of an artificial sweetener. So, and that is how it happens. As I said, these artificial sweeteners, they interfere with the gut microbiota balance, and they cause exactly dysbiosis, which we discussed. And that is one reason why we are advocating to stop using artificial sweeteners.
Okay. All right, Dr. Meghanath. So before we wrap up this session, I will love to address some common misconception. What do you think are the most overhyped claims about the gut health, and that you see in both medical and literature or popular media is very common?
So, Smarika, one important thing let me highlight. So what are we discussed today, the benefits of pre-probiotics or synbiotics? They're all supplemental therapies. They are not definitive therapies for any disease. Neither do the probiotics really reduce the incidence of cancer, nor they can replace the pharmacological therapy in high cholesterol or heart diseases. Okay, so this is the biggest misconception. Okay, so the role of diet pre-probiotics is a supplementary benefit, and it is not a definitive benefit, which the influencers claiming or the people who are claiming to offer the benefit should have this disclaimer. This doesn't replace the actual pharmacological therapy, which are proven evidence-based therapies.
Okay. Thank you so much for sharing your insights today, Dr. Meghna. It was a wonderful session with you. And thank you to our viewers for tuning in. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate us to join on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay healthy, take care.